Spinal fusion is a surgical procedure. It aims to fuse two or more vertebrae in the spine, creating one solid bone. Fusion eliminates motion between the vertebrae and treats various spinal conditions such as herniated discs, spinal stenosis, and scoliosis. Being a major surgery, it's important to talk to your doctor to determine if it's right for you. This article will discuss different spinal fusion methods, their benefits and risks. Remember, this information is for educational purposes only and should not be substituted for professional medical advice. Always consult with a qualified healthcare provider who can provide personalized guidance for your specific condition. Spinal fusion permanently alters the spine's mechanics, so it is crucial to understand the implications before considering surgery. Factors like age, overall health and lifestyle play a role in influencing the procedure's success and long-term outcomes. Choosing the right surgical approach is crucial, depending on the location and severity of the spinal problem. Anterior lumbar interbody fusion, or ALIF, accesses the spine from the front. The surgeon makes an incision in the abdomen to reach the spine. ALIF is used for lower back problems like degenerative disc disease. The anterior approach allows for a larger bone graft, promoting better fusion rates. ALIF can be combined with plate insertion for added stability. However, there are risks, including potential injury to nearby organs. Recovery varies, but pain management and physical therapy are crucial. Posterior lumbar interbody fusion, or PLIF, is a surgical technique that addresses spinal problems from the back. The surgeon makes an incision in the back and accesses the spine by retracting the back muscles. PLIF is commonly used to treat conditions like herniated discs, spinal stenosis, and spondylolisthesis. One of the main advantages of PLIF is its direct access to the spine, allowing for precise placement of bone grafts or implants. PLIF can be performed at multiple levels in the spine, making it suitable for addressing multi-level spinal problems. However, PLIF has potential drawbacks. It involves more muscle disruption compared to ALIF, which can lead to longer recovery times and increased post-operative pain. Additionally, PLIF might carry a higher risk of nerve damage because the nerves are located closer to the surgical area. Despite these risks, PLIF remains a valuable option, effective for many patients with spinal conditions. Careful patient selection and meticulous surgical technique are essential to minimize risks and optimize outcomes. Transforaminal lumbar interbody fusion, or TLIF, is a minimally invasive procedure that accesses the spine through a small incision on the side of the back. The surgeon uses specialized instruments and X-ray guidance to reach the affected vertebrae. TLIF is often preferred for treating conditions like degenerative disc disease, herniated discs, and spinal stenosis. One of the primary advantages of TLIF is its minimally invasive nature, which reduces tissue damage and post-operative pain, often leading to faster recovery times compared to traditional open procedures like PLIF. TLIF also minimizes disruption to the back muscles. However, TLIF may not be suitable for all patients. The success of the procedure depends on factors like the patient's anatomy and the complexity of the spinal problem. In some cases, a more extensive open procedure might be necessary. Despite its limitations, TLIF offers a valuable alternative effective for treating a wide range of spinal conditions, with patients often experiencing significant pain relief and improved mobility. Cervical spinal fusion is a surgical procedure that addresses neck pain and instability by fusing vertebrae in the cervical spine. This procedure is beneficial for treating conditions like herniated discs, spinal stenosis, and fractures. Cervical fusion can be performed from the front, known as anterior, or from the back, referred to as posterior, of the neck. A common approach is the anterior cervical discectomy and fusion, or ACDF, which involves removing the damaged disc through an incision in the front of the neck and inserting a bone graft or implant to fuse the vertebrae together. Alternatively, posterior cervical fusion accesses the spine from the back. While cervical spinal fusion is generally safe and effective, carrying risks like nerve damage, infection, and non-union, most patients experience significant pain relief and improved neck function. Post-surgery, patients typically wear a neck brace to support healing and engage in physical therapy to regain strength, flexibility, and range of motion in the neck. In spinal fusion procedures, spinal instrumentation plays a crucial role, involving the use of implants like cages, plates, and screws to provide stability and support. After removing a damaged disc, spinal cages, which are small, hollow devices, are inserted between the vertebrae and filled with bone graft material to act as a spacer and provide structural support. Plates and screws are then used to hold the vertebrae in place, allowing the bone graft to heal and fuse the vertebrae together. Typically, plates are attached to the back of the spine and secured with screws inserted into the vertebrae. The use of spinal instrumentation has significantly improved outcomes by providing immediate stability and alignment, reducing the risk of implant migration or failure. While the choice of instrumentation depends on various factors like the location and extent of the spinal problem and the surgeon's preference, it's not without risks. However, complications such as implant loosening, breakage, or infection are relatively rare, and the benefits often outweigh the risks. Bone grafts are essential in spinal fusion surgery as they stimulate bone healing and promote fusion between vertebrae. Acting as a scaffold, the bone graft allows new bone to grow and fuse the vertebrae together. There are various types of bone grafts including autografts and allografts. Autografts harvested from the patient's own body have the highest fusion rates. Allografts taken from a cadaver donor are readily available and eliminate the need for an additional surgical site but carry a small risk of disease transmission. Bone graft substitutes are synthetic materials that mimic natural bone properties, providing structural support and stimulating bone growth. Spinal fusion is a major surgical procedure with potential risks and complications. These include infection, bleeding, nerve damage, and blood clots. Infection can occur at the incision site or in surrounding tissues. Bleeding may require a blood transfusion. Nerve damage can result in pain, numbness, or weakness. Blood clots can form in the legs or lungs. Seek immediate medical attention for symptoms like leg swelling or chest pain. Discuss potential risks with your surgeon to determine if spinal fusion is right for you. Recovery from spinal fusion varies depending on the extent of the surgery, and factors like overall health and individual healing also play a role. Post-surgery pain management is crucial for comfort and mobility, utilizing medications and other pain relief methods. Hospital stays typically last a few days, during which you'll be closely monitored. The healthcare team will assist you in gradually regaining your independence, including walking short distances and performing basic self-care activities. Once discharged, you'll receive specific instructions covering wound care, activity restrictions, and follow-up appointments. It's important to follow these instructions carefully to ensure proper healing and reduce the risk of complications. Physical therapy is a crucial part of recovery, helping to regain strength, flexibility, and range of motion. A personalized exercise program will be designed for you, which will gradually increase your activity level as you heal. Spinal fusion can significantly improve quality of life, especially for individuals with debilitating back or neck pain. However, it's essential to carefully weigh the benefits and risks before making a decision. Factors to consider include the severity of your condition, overall health, and lifestyle. Discuss your symptoms, medical history, and treatment goals with your doctor to determine if spinal fusion is an appropriate option for you. Non-surgical treatments, such as physical therapy, medications, and injections, are usually the first line of treatment. Surgery is typically considered when these conservative measures have failed to provide adequate relief. It's crucial to have realistic expectations about the outcome of spinal fusion. While the procedure can alleviate pain and improve function, it may not completely eliminate all symptoms. Additionally, spinal fusion permanently alters the spine's mechanics, which can affect your range of motion and activity levels. If you're considering spinal fusion, it's essential to consult with a qualified spine specialist. They have extensive knowledge and experience in diagnosing and treating spinal conditions. Look for a surgeon who is board-certified and fellowship-trained in spine surgery. During your consultation, be prepared to discuss your symptoms, medical history, and previous treatments. The spine specialist will conduct a thorough physical examination and review your imaging tests such as X-rays, MRI scans, or CT scans to evaluate your condition. Don't hesitate to ask questions about the different surgical techniques, potential risks and complications, and the recovery process. A reputable spine specialist will take the time to address your concerns and provide you with the information you need to make an informed decision. Remember, spinal fusion is a major decision that should not be taken lightly. Seeking expert opinion from a spine specialist is crucial for ensuring the best possible outcome and improving your chances of a successful recovery.